Colorectal cancer is the #2 cancer killer in the U.S. For more than a decade, Katie Couric has been on the front lines raising awareness about this deadly disease. And she joins us now via satellite from the J. Monahan Center for Gastrointestinal Health at New York Presbyterian Weill Cornell Medical Center, along with Director Dr. Mark Pochapin. Welcome to you both.
Hi there.
Hi, everyone. Thanks for having us.
Well, we're so glad you could be here because Jay was 42 years of age in 1998 when he died. And I think a lot of us, we tend to think of cancer as something that happens to people as we get older. And colorectal cancer, we've talked about it on the show many times, but the statistics are pretty staggering.
They really are. I mean, as you mentioned, it is the #2 cancer killer of men and women in this country. 140,000 people. That's a huge number, are diagnosed every year, and more than 50,000 people die of the disease every year. And so our life's work, at least mine, and Mark has been a fantastic partner for me in this work, is to really get people screened, because if it's detected early, it has a better than 90% cure rate. And you can do that through a variety of methods, but about a third of the people in this country go through no screening whatsoever. There's not enough compliance. And, you know, I always say it can save your life, and you really need to get screened. So that's what we talk about incessantly. I'm like the nagging fishwife of colonoscopies. I won't stop, because I see people, and when they succumb to this disease, it doesn't have to happen. They're dying needlessly, because early detection really can save lives.
But Katie, we need people like you to promote colonoscopies, because there is an absolute fear of it. And when you have come out and said, look, this needs to happen, there's been a noticeable increase in the number of people getting colonoscopies.
Right, which is amazing.
And that's huge.
I mean, after you had yours on TV, Katie, I mean, the numbers just 100,000 people ran out there and got their colonoscopies. That's some strong work.
I really did have that colonoscopy many years ago on the Today Show, because I wanted to remove the stigma. I wanted to show people it's not that big a deal. You know, of course, it isn't necessarily on the top of everyone's to-do list, but I think people have a personal responsibility. I know you all were talking earlier about how people need to be their own advocates when it comes to their health care, and people just need to get screened starting at age 50 and younger if they have a family history or symptoms of the disease.
So, Dr. Pochapin, when you're doing a colonoscopy, what sort of things are you looking for, and also maybe touch on some of the risk factors that would get somebody into the office to get a colonoscopy?
Well, the first thing that we do when we look for a colonoscopy is that we're trying to find a polyp, which is a little growth that's not cancer but has the potential of turning into cancer. By finding the polyp, we can remove it right there and then. So the test is actually diagnostic in finding the polyp, but also therapeutic by removing it and removing that potential for cancer. So people have to recognize that it's one of the most preventable of all cancers, but it's also one of the most curable. Just have to get it early.
And it's also a silent killer. You know, oftentimes you don't have any symptoms. You can feel perfectly healthy, and by the time, unfortunately, you're symptomatic, sometimes the cancer, the colon cancer, has progressed by penetrating through the colon wall or metastasizing in another organ. So I think one of the things we always emphasize, you may be feeling like $1 million, but that doesn't mean that tragically you might have you might not have colon cancer sort of growing insidiously in your body, and that's why you have to be screened even when you're feeling terrific.
Katie,
that's the best
Dr.
time to get
Pochapin,
screened.
We've established that colonoscopy is so important, but as you see it, what do you think is the #1 reason why people just shy away from going and get that all-important test?
I think people are afraid, they don't know what it entails, and they need to really appreciate the fact that it's a really easy procedure, and you know, it gives you peace of mind. And as I said, if you don't do it for yourself, you should do it for the people you love, because you need to be around for them for a long, long time.
Yeah. And we also have a responsibility from the physician side to make sure that physicians and healthcare providers make the recommendation to patients, because patients will listen to the healthcare providers, but we have to make sure that everybody who's doing primary care for patients makes the recommendation. If 50 or older, they have to start thinking about colorectal cancer.